Hello and welcome to Our Living, and today is Our Living with Moses, talking about how cripples know all about HIV virus or AIDS. Although AIDS researchers have studied the disabling effects of HIV or AIDS on previous healthy people, little attention has been given to the risk of HIV or AIDS for individuals who have a physical, sensory, intellectual or mental health disability before becoming infected. Disabled individuals around the world are more likely to be victims of sexual abuse and rape than their non-disabled peers. In some countries, parents of intellectually disabled children now report rape as their leading concern, and these young people are rarely reached just by safe sex campaigns. Physically disabled people who are not educated know HIV or AIDS exists, but they never go for the test because they think they can't be affected with it since they are no longer exposed to the sexual relationship. Meeting Gerard illustrated more.
I
was alone since I was young when I made an accident. AIDS is a disease which you can get affected with through sexual intercourse. We know AIDS, but if you don't go for sex, you can be affected. We followed and we heard from people, and the infected ones always talk about it.
So have you ever tested for the HIV or AIDS?
I haven't, at least. I can be affected with other diseases, not AIDS, because I don't engage myself in sexual relationship. I use clean utensils. I don't go for the test because I follow nothing. Even now, I'm getting older. I can go in that.
You get a person who can go down and just try to take you there, outside there to go for the HIV test. Can you go?
No. As far as testing is concerned, I can't because I'm like this. I don't have information on it. And now I'm old. I stopped in primary 3 when I made an accident, and also I lost my father and my mom got married elsewhere. They didn't take care of me. I can only, but my eyes are not good. I was born in 1948.
Not only Gerard, most of the people do not have access to the lessons concerned about the HIV or AIDS. This is a very big problem to them. I went down to NSS actually for information regarding the responsibility of the disabled, the HIV or AIDS patients. I went down meeting the coordinator of INSS here in Burundi, Dr. Ngendakumana Fabien.
Ok, comme je ne suis pas très à l'aise et très précis en anglais.
As I am not good at English, let me express myself in French. On the subject to know if people come massively for HIV tests,
Pour le VIH-Sida, c'est une question.
it is a question which doesn't have a precise answer because generally less than 10% of people affected by HIV know their HIV status.
Leur statut et se sont fait tester.
It's true that it's an important question for disabled persons. Even in everyday life, if you look for example, houses are built, sometimes they don't think about lame people.
Ici, chez nous, avec l'appui
For us here, with the help of Handicap International, we have done our best so that even the lame people can reach our services.
gênent le déplacement puissent accéder à la plupart de nos services.
But disabled people are of different kinds. There are the blind, the deaf, and we have undertaken a program so as to try to offer them some of our services despite their disability.
Malgré leur handicap.
We are conscious that it is a group which is at a high risk because the information cannot reach them. Thus, they are vulnerable. The training in sign language is a reality. People can come here, even the deaf. They can communicate with our advisors. They can give them information, prepare them for HIV test. Even the training in the Braille alphabet has already started, but we continue to master it so as to eventually communicate with the people who have such disability.
The roughly 600 million individuals who live with a disability are among the poorest, least educated, and most marginalized of all of the world's people. Burundi's HIV or AIDS policy has no special provision for HIV education for the disabled. So this section of the population remains largely unaware of even the basic facts about the virus. Few deaf people in Burundi have access to formal education, and the few private schools for the hearing impaired do not go beyond primary education. As a result, not only do they miss out on HIV or AIDS awareness programs taught in schools, but many never learn to read, write, or even sign. Primary School of the Deaf located in Gihosha. I'm meeting their headmaster here. He's called Morishi. Okay, then I think you're going to help me to interpret some of the questions that you're going to be asking for some of your students here. Is that it?
Yes, sir.
Actually, young lady. Yes, can you please ask her what's her name?
She's called Choishaki Edith.
How old is she?
She's 23 years.
Okay, then can you ask her what does she know all about the HIV or AIDS?
Talking about kissing and sex intercourse also.
Does she have a boyfriend? No. Why?
I fear myself about HIV, that's why I don't want to play with the boyfriends.
Did she ever went for the HIV or AIDS test?
Yes, I did.
Have she ever just had any sexy relationship?
No.
So actually, thank you very much for having her. I'll tell her thank you very much. Okay, I understand. Well, on my way back from the school, Edith decided just try to escort me back to the bus. So they had some conversations with his friends, but it's quite interesting because the way they're making up the signs is really interesting. Well, I went down visiting the handicap and meeting Teddy, who is in charge of the advocacy activities in the handicap. As far as deaf are concerned, when I went down in Gihosha one time and I found that it's only primary school. When I tried to contact their headmaster, they told me they have got only the primary school and the deaf do not have the secondary school and the university. So what can you tell about that?
Okay, Burundi, there are some rights of disability people we are not that are not fulfilled. There is not a law that govern their style of living. Programs, for instance, in education or in different field of life, are not well done according to their disabilities.
For example, they are the center. You can find that many of them are that they are begging and sitting down begging. So are there some activities which you provided them?
Yes, because we are just holding some income generating activities in different associations, and we support them during trainings, how they could manage well their associations, how they could manage their accountability and so forth.
Don't you think that one is just to create a job seeking instead of creating job opportunities?
For the moment, we focus on the income activity generating in the association.
The most big problem is all about literacy and job opportunities because they play a big role on the spread of HIV or AIDS in the country. Disability isn't inability. It was Moses for today's Our Living. Catch me next week at the same time on the same day.